Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Glimepiride. Its brand name is Amaryl. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So, Glimepiride is classified as a sulfonylurea. It stimulates insulin release from pancreatic beta cells by binding to the sulfonylurea receptor. In terms of indications for use, this medication is indicated to be used in the treatment of type 2 diabetes. Now, before somebody was to use Glimepiride, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If somebody had a hypersensitivity to Glimepiride or any other component of the product, they would not be able to use this medication. It would also be contraindicated in patients who have a history of allergic reactions to sulfonamide derivatives. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would mainly want to avoid giving this medication to the elderly population due to an increased risk of severe and prolonged hypoglycemia or low blood sugar. An increased risk in cardiovascular mortality has been reported with the use of sulfonylureas. And if hypoglycemia, again low blood sugar, was to occur in individuals using this medication, this may impair their concentration to perform tasks such as driving an automobile or operating heavy machinery. There is a risk of developing severe hypoglycemia with the use of this medication, and the risk would be increased in patients who have hepatic or liver impairment. Hypersensitivity reactions such as Stevens-Johnson syndrome or angioedema have been reported. And this medication is not recommended to be used in pediatric patients due to the risk of hypoglycemia and the adverse effects on body weight. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Glimepiride, they can expect to receive their dose orally, as it is available as a 1, 2, and 4 milligram tablet. So if somebody is using Glimepiride to treat their type 2 diabetes, they would typically start off with a dose of 1 or 2 milligrams taken once daily. The dose can then be increased by 1 or 2 milligrams every 1 or 2 weeks based on their blood sugar response, and the maximum dose would be 8 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Glimepiride, so we'll go over some of those here now. We mentioned hypoglycemia or low blood sugar. This can happen between 4 and 20% of the time. 5% of patients may experience nausea. Dizziness comes in at 5%. And 8% may experience a headache. Some more rare but serious side effects would be the hypersensitivity reactions that we mentioned in the precautions, such as Stevens-Johnson syndrome or angioedema. That's all we're going to talk about today with Glimepiride or Amaryl. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.